You found a lump on your thyroid, and your first thought is, do I have cancer? My gosh, I have cancer. For the vast majority of patients, that's not the reality. Today, I'm going to break down the decision matrix for what you do about it once you decide that it is benign or malignant. If you have a nodule and it needs to be evaluated, know that most nodules are benign. 98% of them are benign. And so we need to determine whether or not a nodule is benign, those last 2%, and we want to be sure that we get the right answer. So how do we do that? Well, the first thing we do is we're going to see you in the office and evaluate you. We're going to feel your neck. And then secondly, we're going to go and get some laboratory tests to make sure the thyroid tests are normal. And then finally, we're going to have an ultrasound. And an ultrasound will give us an image of the thyroid gland itself, will tell us about the nodules, and those nodules have certain characteristics which can lead us to whether or not the diagnosis is a benign or malignant nodule. Benign nodules have certain characteristics, and thyroid cancer has certain characteristics. So by looking at the nodule, we have a preliminary view of what we think the nodule is. Then once that's done, there's some characteristics that might lead us to do a biopsy. And not everyone gets a biopsy. So don't worry that you will go to the endocrinologist or another physician and they will say you have to have a biopsy. That's not always true. What we do is we evaluate that by ultrasound and all the other characteristics, and then we decide whether or not we need a biopsy. And I would say that there's a much lower percentage of people that get biopsies than happened in the past, because we're more knowledgeable about what the ultrasound characteristics that lead us to the biopsy. If we do a biopsy, the results come back and we get a particular answer. But sometimes when we get that answer, that it's not entirely clear. Sometimes the answer is that it's indeterminate. And when we have an indeterminate answer, then we have these molecular markers which are able to help us in defining more specifically whether a nodule is benign or malignant. If the nodule is benign with the molecular markers, we're going to follow you with an ultrasound, or depending upon what the symptoms might be associated with this nodule. Maybe the nodule is compressing your neck. Maybe the nodule is causing you to have some difficulty swallowing. Maybe it's causing you some difficulty breathing. Maybe it just is cosmetically unattractive and you want to have something done about it. And then we get to the point where we have these options for treatment. Again, in a benign nodule, this is. If it's a malignant nodule, most oftentimes it's going to go for surgery. But a benign nodule, we have several different lines of treatment that we can pursue. And the first one is, we can just follow it. But if you have symptoms, then we're going to think about the possibility of two other treatment options. And the one is what we call radiofrequency ablation, which is a treatment that involves using a needle with a heat at the end of a probe, and that heated area will cause the nodule to regress in size. That procedure is done in the office. It's done with just a light anesthetic, such as Xanax or something, to kind of make people calmer or more relaxed when they're having the procedure done. And it usually takes around 20 to 30 minutes to do a reasonable sized nodule. This will then result in you being able to go home that day, and there's a minimal amount of swelling, some redness, and the procedure is mostly very well tolerated. So that's the procedure to decrease the size of a benign nodule. Doesn't make it go away, but it does make it decrease in size. Usually at least 50% is what we're looking for in these treatment. The other option is a surgery. And of course, surgery is under general anesthesia. It's done either in a surgical center or in the hospital. It can be either one side, or what we call one lobe of the thyroid, or it can be a total thyroidectomy. depending upon the procedure, some people may be able to go home same day, but of course, they'll have a scar and they will need to be monitored post-operatively by the surgeon. And so it's certainly more invasive. It has more implications, because another possibility is if one lobe is taken out, you might develop hypothyroidism. That occurs about 25 to 30% of the time, and then you can be required to take thyroid hormone. If you have both sides removed, if you have a total thyroidectomy, then people will definitely need to have a thyroid hormone replacement. And again, the determination between the RFA procedure and the surgery procedure is based upon many characteristics: how big the nodule is, where it's located, and the desire of the individual patient to avoid some of the issues of surgery and maybe have something that is easier to do and has less issues associated with it. To remind you, if you have a benign nodule, if you're not having any symptoms or you're not bothered by it and you want it to essentially be followed, we do ultrasound in those situations, usually 6 to 12 months after the initial visit, and we can follow that over time, because sometimes nodules will increase in size and they will develop some symptoms associated with them. But many times they don't, and these benign nodules will be there. They won't go away, but they will be there, and be followed over a period of time.